Hi, my name is Patricia Ruiz. I'm a bilingual speech language pathologist, and today I want to share a video about a few tips on direct treatment for kids who stutter. Let me tell you a little bit indirect and direct. I did a video that you'll see on my playlist that it's about indirect treatment. Indirect treatment means that we treat the environment around the patient instead of treating the patient. So indirect treatment, I'll run through it really quick, is about the parents speaking slow, the parents making the environment a peaceful one and not a rushed one, the parents being a good model for the child, and the parents not interrupting the child when he's stuck or is trying to say something in a manner that's not fluent. So that's what we mean as speech pathologists in treating indirect treating. Indirect treating means treating the environment and not the actual patient or the actual child. In this video in particular, which if you like, please subscribe to my channel and follow us on Instagram, I'm going to give you tips of direct treatment. Like, what would I do if you brought your child to my office because your child stutters? So first and foremost, this is a video also that is also only for children, right? Because there's techniques for adults, techniques for pediatric, and this is only for children who stutter and children who are past the indirect phase, which is indirect treatment should be like anywhere from maybe 3 to like 5-ish or 6, and direct treatment should be from 6 on, so school aged, kids that are aware that they're stuttering, that are aware that there's something kind of different between them and other kids. So these are the kids we want to treat directly. We don't want to treat kids who are unaware that they stutter directly, because now we're taking it a problem that may have not been such an issue that could have been spontaneously resolved into something that now, they see and understand that is not okay. A lot of children who do developmental stuttering, which is early on from like 2 to 5, do have spontaneous recovery. We call that spontaneous recovery. A lot of patients are eligible for spontaneously recovering, but a lot of factors have to play into that spontaneous recovery. So example, a lot more boys to girls stutter. That is a fact. However, a lot of boys do spontaneously recover quicker than girls. So there is a lot of things that play, genetics, environment, gender, a lot of different things take place. So for spontaneous recovery, we would do another video on that and what we would do to treat that. But in this video, like I said, I only want to talk about tips. So what do? First tip, right? We want to model slow speech. Why is slow speech so important, right? When you tend to talk fast, you're like rambling on or not saying enough words to the breath that you took. So it goes all the way down to how are you breathing? How many words are you saying? What's the rate of your speech? So we want to slow things down. So the first thing I would do with a patient is talk to them about slowing down their speech rate. There is a magic number to that, what that number should be. I'm not going to go into it because it's really not necessary. The magic number is the number that makes the patient not stutter. So that number could change, it's a range. So we want the patient to slow down. So we're going to teach them to slow down. How do we teach that? We're going to include pauses in different sentences. So we're going to go through a bunch of sentences that we wrote down. We're going to say, hi, my name is Patty, right? Hi, my name is Patty. I'm 42 years old. Okay, so we're not going to say, hi, my name is Patty, I'm 42 years old. We're going to slow it down. Hi, my name is Patty, / take a breath, I'm 42 years old. So we're going to teach the patient to talk, breathe, talk, breathe, talk, breathe. That is a direct form of teaching your child to slow down. Indirect is for the parents to model slow speech at home. So direct is exactly how I'm saying. You talk, stop, breathe, talk again, stop and breathe. How do we do that? We like to do that first by reading sentences, because when you read, it's a lot more controlled, right? I will write down a sentence, or we can come up with sentences together. We put a / that means take a breath. And then, which I'm also going to show you what type of breath to take and how to take the breath and when to take the breath. We're not there yet. And then you're going to take the breath and you're going to continue with your sentence. So we're going to add more words to these sentences and less breaths, because we want speech to look natural. We don't want it to be robotic. We don't want you to pause and then keep talking and then pause and then keep talking, because that's just not natural. And we want to teach you a natural, effortless flow of speech. That's what we want. That's our goal. So we're going to do sentence, and then we're going to make them longer. You should practice this with your child if he is in the same category that I explained earlier, meaning age, meaning circumstances, right? So we're going to do pausing and showing them how to speak slower. So that's my number one tip that I would do with a patient that came into my office for the very first time. The second tip that I would do with my patient is diaphragmatic breathing. A lot of people have this kind of breathing a little bit, misunderstood, I guess, because we are taught that we breathe in, we inhale, and then we exhale, right? But a lot of this breathing is shallow breathing. You're shallowly taking a breath, like right here, and you're breathing out, but that's not a real deep or diaphragmatic breath. What is a diaphragmatic breath? It is a breath you take and you hold in your diaphragm, and the breath pushes up through your vocal cords and it comes out. It's kind of like, I like to explain it to kids as a Ferris wheel, right? The breath comes in, it fills up your belly, and it comes out. But when it fills up your belly, we always think of it like this, how I just explained it, right? However, it's not. It's like this. So when you want to take a breath, you want to make sure that your whole belly fills in. And when your belly's full out, then you let it out and you exhale and the air comes out, right? A lot of people have this breath backwards. They breathe in and they suck in their stomach, and then they breathe out and they fill their stomach. But that's not how diaphragmatic breath works. It's actually the opposite. You have to fill in your belly with the air, and then as you exhale, your stomach goes flat. I would show you, but I am sitting behind my desk. So this is very difficult to teach. As per the conversation that we're having right now, I would have to, if it was my patient, I would lay them down on the floor. I would place a book on top of their stomach, and I would tell them, okay, push the book up, and then they will see that their stomach is filling in with air, and then we would push the book down, and we would see how the air now is coming out. And we would take a few of these breaths. It calms the nervous system, it calms your mind, it calms your whole body, and then we teach you how to breathe this way. So when we're doing the sentences that I explained a little while ago, pause and take a breath. You're not taking the shallow breath, because that's an incorrect breath. So we'll teach you how to do diaphragmatic breathing, and then we'll teach you when to take the breath, right? Which is how these two things go together. So we want your breath to be deep, and we want it to be good, because if it's good, you can add more words to this breath. For example, if I take a breath like this and I just talk to you, right? I'm going to run out of words, and instead of pausing to take a breath, I continue on my very last little breath. And that is the one thing you don't want to do when you stutter. You don't want to run out of air, because that's when you're going to get stuck the most. So you're going to teach your child at this, if you're watching my video to help your child, is how to do these diaphragmatic breaths, so the breath is long and deep, and your child is able to say more words at a slow rate, right? Because we do want more words, but we want it at a slow rate. We don't want the rush, because you're running out of air. So, and it also, these breathing techniques also calm the nervous system, which is what we want, because sometimes our nervous system, causes us to be a little bit more excited, or causes emotions, and we want those emotions to kind of be at bay when we're teaching kids to not stutter. So these two tips are very, very helpful. And the last tip that I have for you is called Easy Onset. It's a very popular tip that majority of SLPs or speech language pathologists use, and it's teaching the child to vocalize right before they start talking. So we want to say apple, so we would say apple, right? We start like vocalizing the first sound first. So apple, right? We're not going to say banana, because b really doesn't have, we want to use a vowel in the front. So we want to say I like cookies, for example. So they teach the kids Easy Onset, because it shows them how to start talking a little bit before when you exhale, and then you keep talking and you don't get stuck. So in Easy Onset, you want to just the easy forward fluency, right? You want easy talking. That's called Easy Onset. So when you're trying to teach the kids at home, you want to talk to them like this, like just an ongoing vocalization of slow speech. So today at school, I had pizza. So if your child starts doing Easy Onset, the prevalence of them stuttering throughout that sentence, it goes down significantly. So that's what we want to teach. Easy onset. You want to teach the diaphragmatic breathing as well as the talking slow with pausing to take a breath. So these are the 3 things I would definitely do if you were to bring your child to me in my office. And these are the things I encourage you to practice at home with your child. And I encourage you guys to join organizations, ask other therapists, watch videos, and, try different tips, because not every single tip is, the exact recipe to making stuttering go away, but we definitely can make stuttering better. So I want to thank you for watching. Subscribe to my channel. I will be coming out with a lot more tips, a lot more courses, a lot more lives, a lot more information, because the goal is to help others who stutter. That is my main goal. And my second goal is to educate other people about people who stutter. So if you have the same goal as me, follow me. Thank you.